Power up. Welcome to Energypreneurs, where I bring to you the exciting new opportunities in solar power, battery, and electric cars. I'm your host, Sohel Hasni. I have been tracking and analyzing these technologies on LinkedIn and Twitter for more than 10 years. Now we meet on podcast. Good morning, Michael, and great to see you again.
Great. Good morning to you too. And I hope the last year since we talked last has been safe for you, but also you've been able to be productive to some degree.
Yes. I think I was lucky enough to make some good things out of the COVID lockdown, this podcast being one of them. Yeah, when we spoke last year, it was really, we did not know what we are getting into. I guess we gotten used to the world we are in. So I'd like to understand from you a bit more about what you think the post-COVID world might look like, and then if we can relate that back to people's willingness to act a bit more on climate change, because we identified a common problem. So maybe before I get into this, if you could introduce yourself, Michael, that would be wonderful. Thank you.
Sure. So my name is Dr. Michael Friedman. I'm a medical doctor and a medical epidemiologist. And I was with the U.S. Centers for Disease Control and Prevention, the USCDC, for 25 years. I just retired on October 1st. So I put in my years, and I'm looking forward to my next step in my career, but it will be outside of the U.S. government. So I enjoyed those 25 years. It was a wonderful experience. I got to work I lived in 4 different countries besides the U.S. I worked on the Native American reservations in the American West. I dealt with Ebola, with global HIV efforts, and obviously most recently COVID as well. So it was a really fascinating and very fortunate career with CDC, and now I'm contemplating what are the biggest things to work on in the world that I could use my skills on. I think global warming is one of those on the top of the list. However, as a medical epidemiologist and doctor, I'm still trying to figure out what exactly my role in that might be. But certainly, as a citizen of the world, that's a very important issue.
Yes. Thank you for that. Yes. I think someone with a background like yourself, working with the various part of US government and understanding how systems works, that will be a tremendous value to the sort of climate communities, UN and other. I'm sure before we speak next time, you are somewhere else again, super busy, although you just retired, you said, no?
I just retired, yeah. So people think I'm out playing golf. That hasn't really happened yet, but maybe I'll play a few rounds or do some other fun activities. But I will, because I really haven't stopped working in over 25 years. And then before that, I was in my medical training and medical school. So it's really been, I guess, around 35 years or so that I've never really stopped. And so, for those that are out there that are either in retirement or close to retirement, they know what they have an understanding of what I'm talking about. For your younger audience, they're probably, wondering what's what's this thing about retirement, and that's probably a ways off. But time flies quickly, so it's
yeah. I mean, I'll be 60.
Even for your younger audience,
looking at retirement too.
Yeah, exactly. Anyway, so there's pros and cons to that, but it also, I think retirement, what it does is it also is a chance to reflect on not only your career, but the state of the field you're in. It's kind of a time of reflection. So that's been true for me. And I think COVID has been a time to reflect too about the state of public health in the world. And like you said, not just public health, but even political decision-making, and what's important to us, things like that. So there's really a lot of opportunity that comes with the COVID pandemic. I mean, it's obviously been a terrible pandemic, and it's not something we would wish on wish on anyone, and it certainly is not something we hope it repeats itself. But they say, every crisis is there's a silver lining in, and every crisis we should take advantage of it. So there are things that we hopefully can do because of this crisis.
Yeah, I mean, that's what I was sort of pondering, because you were at the forefront, the head of CDC in Bangladesh. And Bangladesh is a large country by population and, of course, by many standards. Now, being at the forefront, being the key person, people asking you all sorts of questions, saying there is a darkness out there we don't know, and you provided light. So if you take that experience into account, and you must have also seen how the politicians, how the average Joe Bloke on the street, how their attitude has changed. So what's the key takeaway? Do you think that we have fundamentally changed, having gone through the tunnel or nearing the end of the tunnel, I hope, no?
So you ask a lot of really good questions, and there's no simple answer to that question. I mean, yes, we have changed. I mean, this pandemic has changed the world. Has it changed it as profoundly and dramatically as we would have thought? Maybe not, but it certainly is changing us. And what sticks and will be here for a long time in terms of that change, and what is just a temporary change, I think is one of those things that we don't really know until we're over with it. But I think that there definitely are some things that people are going to think about differently and maybe do differently in the future. There's also, I think, a lot of lessons to be learned from this pandemic. And lessons are not necessarily the same as change, because lessons are things we should learn, but they may or may not actually happen. There may be recommendations and things we need to think about the next time or understand from this, but it doesn't necessarily mean a society is going to change because of those lessons. So there's really two sides to that. One is what are the lessons, and two is what are the changes, and they're not always the same, unfortunately. So in terms of what are some of the changes, that varies from country to country and from person to person, right? So if I'm a garment worker in Bangladesh, my life probably has not changed that much, and my thinking probably hasn't changed that much pre and post pandemic. There was a little bit of fear. Temporarily, it might have changed. Maybe the garments were closed for a month, but at the end of the day, they were back at work, and they're still working 50, 60 hours a week, barely scraping by a living, and they're just in survival mode, right? So they're not thinking about societal change and lessons. They're just trying to survive and get the job and keep their job and maybe move up the ladder a little bit in terms of what they're being paid. So, for someone like that, I just use that as an example because coming from Bangladesh, that's a pretty typical example. But someone like that, it's not going to be that much of a change. And so for probably a half or a third of the, a third or a half of the population of the world, they're probably just going to be like, this was just another challenge in life that we had to face. Like, it's like all the other challenges that we face, whether it's, crime and corruption and, abuse and, in poverty and poor education systems and all the other problems, pollution and all the other things that they're facing day to day. This is just another problem that they had to face. And, I know from firsthand being in Bangladesh that those people didn't take COVID as seriously as others did, because for them, it was just another obstacle. And it wasn't a special obstacle. It was just another obstacle. And that's important to realize. I think it's important for many of us to realize that we're fortunate enough to be in a position when bad things like this happen that we take notice and we're scared by it. But there's a fraction of the world that is kind of a little bit like, this is my life every day. There's a pandemic that ever since I've been 5 years old is going on. It's just not a pandemic. It's all the other challenges I face in life. And So, for people like that, change is going to be different. Like they're not really going to be thinking about change the way we are. But I think maybe it's a decent analogy, at least for people, who've been more fortunate, including myself, to really just think about what it's like to live in those shoes. Think about, how scary the pandemic was and how uncertain life was for a period of time. And that's what some of these people are going through all the time, and we say, oh, for example, our mental health got worse, our anxiety levels and depression levels got worse because of COVID. Well, a lot of those people have an underlying anxiety and depression issues and stress or disorders on a regular basis because of all the traumas they're facing in day-to-day life. So there is a little bit of something to think about with that. But for the rest of us, I think that, for the more professional class of people and others like that, I think that one of the changes is our lifestyle, right? Our lifestyle has become more simple, has become simpler. We spend more time at home. We think about what do we really need to do and what do we not really need to do. Do we really need to go on that vacation? Do we really need to go on that business trip? And so do we really need to have that meeting? Do we need to have that dinner guests over? All of these things have now made us question kind of our day-to-day life and rethink what's important and what isn't. And for some people, that may mean that, yes, those things were all important. I got a lot of pleasure out of those things. I enjoyed the social interaction. I enjoyed the camaraderie at work, and I want to go back to that. That's a lesson, and that maybe not a change, but that will kind of make them a little bit more determined that that's important in their life. For others, they may say, you know what, I didn't miss it. I didn't think those interactions were that great. I don't really like those business trips. All of those, things. I didn't want to be away from my family so much. And for them, this is really profound because now it really opens the door to thinking about maybe I can be successful and productive without having to go through all that. And so that's another whole challenge. Now I still think the jury is still out in terms of that productivity. Like, is one better than the other? So there's a lot of people that I speak to that have said, this telecommuting and having the offices closed or partially closed has been great, and I feel like I've been more productive. Mm-hmm. I would say from my own personal standpoint, I don't agree with, I don't feel that way. I personally feel, and maybe it's me as a physician or part of my training in public health, is that I feel like the physical interactions are what gives my work meaning and lets me really understand what's really happening. And so being on a Zoom call with a bunch of colleagues is not the same in terms of understanding the public health realities or as a physician, if you're doing a work with a patient, a teleconsult, it's not the same. I think there's something missing with that. And so at least in my field, I feel like there's something lost with that. And I can tell you, for example, CDC's offices have generally been closed for the entire pandemic. People may not realize that. Almost everyone is telecommuting, and there's a few people coming in that need to. But when I came back from Bangladesh and came back to headquarters, it was like a ghost town, and I didn't get to see all of my colleagues, and I didn't get to have those hallway conversations about what's going on in my life and what was Bangladesh like, and what do we think next, and I have a new idea that I want to run by you. I mean, none of those things are happening. And so, yeah, we have our Zoom calls, but Zoom calls are very structured, and they tend to, I don't even know, I'm not an expert in this area, but I think that when you're on a Zoom call, the decision-making process and the way things are discussed is different than in a different kind of conversation or different type of atmosphere. And so that's something that we really have to kind of look at is how does that affect it? Some people will say that in a meeting, it's not that different. Like, you're sitting around a table with 15 people around a table, or you're on a Zoom call with 15 people, it's not that different. And that might be true. but that's not kind of the interactions I'm talking about. I'm talking about more of the one-to-one or small group interactions that you have in the hallways or you have in your office with colleagues and others. Or if you're on a business trip and you're spending time with people, even if it's going out to dinner or they're showing you their offices or those kind of things. It's a different experience than being on a Zoom call. So yeah, so I think this is a big question for the world and a very important one, because if productivity is different by teleworking, and I don't mean better or worse, but just different, and you multiply that by millions, maybe even a billion people who are doing it, that's a huge impact, right? So we don't really fully understand that yet. It's kind of like the social media craze and the expansion of our iPhones and our emails and everything else. Like, we just do it because that's just become the norm. But have we really stopped and asked ourselves, is it really making us more productive or not? Or is it just creating a lot of noise and a lot of distraction so that we're not able to think about the real issues and the real important things? So, we can sit here and talk about this all evening. And maybe this will be part of my next career, to look at some of these questions. But yeah, for right now, we don't really have an answer to that. But that's one area that I think the pandemic has opened up the Pandora's box to, which is, what does it really mean to be productive? What does it really mean to be creative and to be effective in our work? And for me, the pandemic has been very important, is to drive innovation and to be able to think quickly on your toes and make decisions. And so, at least in my field in public health, these kind of issues are very, very important, because we're being asked to produce and to think quickly. And so if our ways of doing that have changed, and now we're either more or less productive than we were before, or we're productive in a different way, it has a direct, immediate impact. Whereas maybe another company, because things were slow during the pandemic, or it takes time to understand things, maybe other fields haven't really experienced that yet. They haven't really fully figured out, how good or bad the last year or two have been for their work. For your audience, they're, in the energy sector, how much innovation is still happening over the last year? How many new ideas and new projects started, during COVID compared to before? And is that because funding stopped and because political decisions weren't being made? Or is that because people's innovation was changed, or they were just a little bit distracted by the COVID pandemic? Or is it because they didn't have these opportunities to have these small group interactions to drive innovation or not? So that's a separate question for you and your audience. Maybe it's a separate podcast, but it's really an important question. Anytime we go through this kind of social change, it begs a lot of questions. And so that's really what COVID has been. It's been one giant social change in many ways.
I like the term, one giant social change, because what you just mentioned earlier, that what is productivity, the meeting, the Zoom call. I mean, we had a meeting yesterday with quite a few very senior colleagues, about 15 people in the room, literally speaking. And then one of my colleagues, she was texting me on WhatsApp saying, "Oh, you missed this point," and I picked up the phone, and then I had to mute. And then that dynamics. But had it been a physical meeting, we'd have been 6 of us on this side and the client side. And then we said, okay, this specific person has an issue. Okay, let's break it now. Let's go for lunch and raise that on the sideline and understand he or she is not ready to share with the wider group his concern, because there are political hierarchies and things like that. So yeah, these dynamics are very important. But I think one thing that COVID may have done, we are all into a box of different sizes. Right now, it's sort of suddenly the box is gone. Some people, as you correctly said, I like the box. Some said, no, I like the right hand side. I like the left hand side. So that will create a lot of new opportunities in everything we are doing. No, people are saying, hey, I think we figured out in our own way how to do it, because last week I talked to someone over this podcast platform on digital financing, especially in the Philippines, how dramatically use of a product called Gcash and this money with your mobile phone has changed dramatically, right? Everyone has access to those units. Now, we discussed innovation. I know we can continue for on and on, but do you think a single collective global problem that gave us tons of time to think through, coming to the basic human element that you have your families, you have your neighbors, you have the world, that we all have it common, doesn't matter what national boundaries are. Do you think people will be more innovative in future because having gone through this process, trying to see that, because we had to innovate, right? Many people had to say, hey, how do I leave all 6 people in this 2-bedroom apartment, or whatever situation people are in, right? Because we had to sort of adjust to what we have. No? Do you think we fundamentally made any progress in that area?
It's a really good question. I think that, there's different ways to look at innovation. There's personal innovation. So personal ability to make changes to your life to keep yourself safe. In this case, to keep yourself safe and somewhat productive. And I think that for many people that, yes, that was an opportunity to be a little bit more creative, to think, okay, how do I keep myself, my family safe? How do I still interact with my elderly parents or others? How do I still be productive at work and still be safe at the same time? How do I keep my sanity and exercise or do the other things that are important in my life? And so people had to kind of innovate and think about all these things. Now, how well they did.
Sorry to interrupt, but people have done a bit more. I mean, people say, well, I've been doing exercising. My friends run, oh, maybe I should run an exercise Zoom class. Then they say, actually, I can run a subscription business also of it. So I know a few people who are a good cook. Suddenly in my neighborhood, through WhatsApp, they're selling cakes. I make only 20 cakes a day. Suddenly become an entrepreneur. She used to work for a company that, of course, don't have access to anymore. So suddenly change. And this happened because of under pressure, demand, no?
Yeah, no, I think those are great examples when they do happen. And I'm speaking as an epidemiologist. So I don't know the data. I don't know the big picture. An epidemiologist, just for your audience knows, looks at health and health issues from a population standpoint. So instead of a normal everyday doctor saying, you're my patient in front of me, I'm going to think about health from your perspective and our perspective, treating you as an individual. An epidemiologist looks at it from the point of view,
very macro,
are part of a whole society and a whole community, and I'm thinking about that whole community. So when I look at these things, I say, yes, there are some innovators. There are some people, like you just mentioned, that did incredibly interesting things and took advantage of the situation because they needed to or because they wanted to. But we don't know how many other people were completely stifled by this. They were paralyzed by this, that they didn't come up with any creative ideas. We live in a world where we're surrounded by like-minded people, right? So it's easy for us to kind of look at people and say, oh, my friend over here started a new business and this person has been really successful this year and did a new thing and created this new hobby. But we have to realize that there's a lot of the world out there that isn't so great at change, and that's what makes entrepreneurs special, is that we do adapt to change and we are excited about the opportunities that change brings. But there's a huge chunk of the world that has the opposite feeling, that they just are terrified of change, right? And they don't want to innovate and they don't want to change. And it's not because it's not nothing to do with them as people. It just has to do with their background and the way they've experienced life up till now, right? So so we have to see that there's many sides to this
Mhm,
whole pandemic. And certainly this pandemic has been an opportunity for those that are motivated and have the resources, whether it's financial resources, friendships, social networks, whatever it is, those resources to make those changes. That's great. And so a lot of people have done that. But there are also a lot of people out there that have been kind of paralyzed by this and felt like they haven't been able to make the right changes, or they don't know what to do. And so and let's be honest, the information has not been so clear. It hasn't been so easy to figure out exactly you should be doing the last year and a half. Do I send my kids to school? Do I not? Do I get the vaccine? Do I not get the vaccine? You know, when I get sick, do I stay home or do I go to work? I mean, should be, some of those should be obvious decisions, but we live in a world where information is getting very confusing sometimes, right? I mean, we've got millions of Americans who think that this vaccine is terrible for them, and that's not necessarily a rational decision or thought. That has to do with the fact that they aren't really interpreting science very well, or are being misinterpreted by others. So and I don't know what degree this is happening in Asia, maybe to less degree, but it certainly could happen anywhere. And so these are issues that we need to be also thinking about on a bigger scale, which is that how do we get more people to accept change and uncertainty and see the positive in it? Okay, and that may be one of the things that needs to come out of this whole pandemic, because as we talk about global warming and we talk about the fact that there may be future pandemics and that there are other changes happening. I mean, society is just evolving and science is evolving so fast. There are so many things happening that we as humans, I do think, have to figure out how to adapt to change quicker than other generations ever had to. And that's a really important skill to learn. And I mean, one of the questions fundamentally you can go back to is, do we teach this in school? I mean, is there systems out there that teach people how to adapt to change? And, schools, education ideas are changing, but a lot of education for the vast majority is still rote memorization and old school of thinking. So, even when you take a field like the education system and what they could learn from this COVID crisis, it would be, there's a huge amount of opportunity there to think differently. Number one, this online learning. That's the obvious one. But even deeper than that, it's about how do you teach young people to adapt to a changing world? How do you get them to filter through various pieces of information? They go to one news channel and hear one thing, and they go to another news channel and hear something else. How do they balance that? How do they figure out what's the truth? This is a very modern day issue. When I was growing up, we only had a couple TV channels, and they pretty much said the same thing. They were all middle of the road. So you couldn't pick you couldn't pick the way you wanted your news. You just got what it was. So I'm throwing out a lot of different ideas here, but these are all fundamental things that go beyond health. This was a health crisis, but really it was more of a social and information crisis as well at the same time. And I would even add that it was an educational crisis. And that's a big one. Mainly I say that because schools were closed for a lot of places around the world. And this is a vitally important issue that I think we all need to understand. For much of the world, one of the initial reactions to COVID was to close schools. Mm-hmm. And unfortunately, the reaction was to keep schools closed until they were clear that it was safe to go back to school. But what I think a lot of decision makers and people didn't understand is that every day you delay sending kids back to school is a day that you're digging those kids into a deeper hole to get out of it. Okay, and if you're the child of a prosperous family that has strong educational culture in it, and then you're likely to learn well at home. You're going to have parents that are telling you, don't just sit and play video games, go and, read a book, and let's, make sure you're doing those online classes. And, you're going to find other ways to continue your education. It may not be the same as going to school, but you're going to still be moving forward in life. But for a vast majority of kids, they didn't have access to that, or it wasn't pushed. And so their learning kind of stopped. And I can tell you, in a country like Bangladesh schools were closed for almost 18 months. Okay. And 90% of those students probably never really got true online learning. Maybe 10% of them did. I don't know what the official numbers are, but it's even if they said they took a couple of online classes, the amount of learning they actually did, I can almost guarantee you, was minimal, and it wasn't consistent. So you're talking about a year and a half of maybe 30 or 40 million kids, having stalled educational process and stalled social development process at the same time. And one thing in public health, your audience may or may not know this, in the last 40 years, the health outcomes around the world have greatly improved. Okay, that's something I think most people realize. Infant mortality has dropped, life expectancy has increased. All of the big numbers that we know have gotten better in terms of at least death rates. In terms of quality of life and other things, it's a little more controversial. But in terms of actual mortality level, things have gotten much better in the last 40 years. And the biggest driver of that has been primary education, and to some degree secondary education. Okay, especially of females, but it's also the boys as well. But that improvement in education is probably the biggest factor improving health outcomes around the world. So if you think about that, and you think now that we've probably taken 1 billion children, or whatever number it is, probably 1 billion children around the world, and we've stalled their education for 1.5 years, how much have we lost because of that? In terms of public health gains, and some of these kids are not going to go back to school, unfortunately. So it's not just a temporary gain. Oh, they'll make it up, Yeah. So instead of graduating when they're 17 or 18, they'll graduate when they're 19. I wish that would be true. But I don't think that's necessarily going to happen. So this is a huge public health challenge that we're coming into now as schools reopen. Bangladesh reopened their schools, I think, a couple of weeks ago. But how many of those students went back to school? And how do we get them back in school? And how do we make sure that they catch up on their learning the best possible way? That is a tough issue that we've got to work on. And this is important because we need an educated society to deal with the other issues coming up in the world, not just COVID, but when we talk about other public health decision making, when we talk about energy decisions, right? When we talk about investments and political decisions about elections and everything else, you want your society to be as educated as possible so we can make the right choices. And if that's been stalled, that's a huge issue. So that's one of those fundamental underlying challenges that we faced with this pandemic. And I think the lesson should be learned in terms of this is that I think many of the countries were too short-sighted in wanting to be safe and not open schools, and didn't really understand the true risk benefits related to that decision making. WHO and others had said schools should be open in general. So it wasn't a lack of global evidence. It's just that a lot of local decision makers, and I say local meaning like at a country level or at a local level, district level, just said they just weren't comfortable. They just were scared, and said, I don't know. If I open the schools and we have a big outbreak, and I'm going to get blamed. So this is the kind of decision making that we need to analyze and learn from. This is the kind of stuff that we need to kind of figure out, how can we make better decisions going forward in terms of these longer term issues. So we're not just thinking the next 4 weeks or longer. We're thinking the next couple of years or next decade, what's going to have the biggest impact. And again, that goes into energy issues and global warming issues, right? So if I put a gas tax on in order to spur development of alternative energy, the immediate reaction people are going to say is, well, that's going to cause some riots in the streets and protests. And that's not good for my political career, and it's not good for our town. But that's very short. It's only looking at the short term. It's not really looking at the fact that people will adjust. They will stop the protests event. They will stop protesting, and they will accept the fact that there's a tax, and they will innovate to try to come around on how to save money and find alternative ways to get energy that's cheaper. So that's I think that's just an analogy I could try to draw between the two, something like that.
Thanks, Michael. I think you have brought up very serious topic on the table, that 1 billion students have missed out on their classes, and also sort of because of COVID. Yes, maybe the people that we know, that yes, we know that have taken this as an opportunity and made something out of it. But there are people who has been paralyzed and they're falling behind. And you can be in front of internet and someone is having connected to hundreds of right-minded people moving forward, and someone may be sitting there with the same internet and feeling super isolated because no one to talk to. Yes. I mean, these are very serious issues, because I wanted to ask you, what are the things you worry about most? And now you have brought something even I could not think of. So what can the governments do to bring these children that they have missed out? I know many families' situation. Some of my colleagues have clearly said that, yes, we taken our kids off schools or put into a different school. I cannot come back to work full time. I might take as a work if I can afford half the time or 60% of the time. That's a lifestyle choice they have already announced that we are going to make, and many people are in that boat. But then society as a collective, what can they do? Do you have any thoughts as a public policy maker to bring these people in? That the case you use in the case of Bangladesh, 18 months of schooling, that's a lot of schooling. And these teachers are not well trained to be able to run Zoom classes, because that's also a very specialized skill, no? And tools you need to have.
Exactly. No, there's a lot of infrastructure and changes in learning that have to happen. What they can do going forward is a couple of things, I think. One is acknowledge the fact that this has been a huge loss to that society. And I listen, I said 1 billion people. It really depends on country by country whether they close the schools or not. So, for example, I don't know what happened in China. Maybe China never closed their schools. And so, that's a lot of children, then therefore, still went to school. I don't know across sub-Saharan Africa, what happened in terms of the schooling. Again, maybe schools weren't affected very much in places like that. Maybe they were. I don't know. I don't have all that data to know. But I do know from places like India and Bangladesh that a lot of schools were closed for a very long time period. And that would have a major impact in those societies. But again, you'd have to look at it country to country to see whether it's been the same everywhere or not. Obviously, there probably are some differences. So one is to acknowledge this in the places where it really did have a big impact, and I think acknowledgement leads to at least some action, right? If you want to sweep it under the rug and say, well, that was in the past and we had to do what we had to do and let's just move on with things, that's nice to be able to say that, but that's not really being honest with yourself or with your society. And you need to kind of figure out, okay, well, we did this is a decision that was made, we can't go back and change it, but what can we do to try to make sure that the impacts of this were lessened? So do we need to create better incentives to get the kids back in school? Do we need to really create some kind of, closer monitoring to see how many kids are going back and how kids are doing when they go back, and maybe offer some extra interventions and activities for the students that are struggling with coming back. So, these are some things that could be done. The third thing that can be done is just to remember this for the next crisis. The next crisis may be another pandemic, but it also could be something else that we're not really aware of. It could, it could be some other natural crisis. It could be some other type of political crisis, and there'll be decisions the same way. Is it safe for our kids to go to school? If the air pollution levels are so high, should we send them to school or not? Those kind of questions. And so we need to kind of remember this crisis and what happened when we make decisions for the next crisis. And that's not easy to do. I mean, unfortunately, we are not very good at learning from history. I mean, and really, really learning as best we can. Yeah, we do learn a little bit of lessons, but most of the wars that we end up fighting are reproductions of previous wars. People just don't remember the lessons after so many years. And so we really need to, do as much as possible to kind of document those lessons and try to keep it in the forefront of our psyche. Okay. One of the things we did in Bangladesh, and I'm just going to put a little plug in here, is that we actually created a documentary on the COVID crisis about 6 months into the pandemic. So soon after we did our podcast last year, we started a project where we started documenting the crisis, and we created a 25-minute film documentary on the crisis. And I can tell you, it was an incredibly difficult process to do. It did not meet with a lot of support, because people are worried about what you're going to say, and people were scared to be part of it in some ways. But having said that, we got some wonderful participation and really captured, I think, the essence of what was happening in Bangladesh at that time. And the reason we did it is because this kind of crisis, this experience needs to be documented. It needs to be captured, right? And our memories, our brains are not that great at remembering things. There's a lot of social science studies that show that we change history all the time in our brains. We change it to fit our vision of the world or our narrative of who we want to be or what we experienced. And so there's a lot of revisionist history in our brains. And so you need these kind of experiences. You need people to really critically document things in order for that to remain alive. And so, that's just one example where the effort really needs to be put in to document what's happened. It's not too late. It will be too late if we wait another 2-3 years from now, because then you're going back in time and people will tell you what they remember, not what really happened. But, even if we start right now, even if one person listening to this podcast says, this is a great idea, I need to get out with my iPhone and start doing some, I'm a budding documentary filmmaker, and I want to get out there and do it as a hobby or some other way, I think go for it. This is an extremely important time period to capture whatever you can. And there hasn't been as much of this done as there should be. So that's another plug I'll put in that will help us in the future in terms of making these kind of decisions.
Yeah, very good point. Yeah, I think it needs to be documented because otherwise our filters throw out the things that we don't like or we don't need rather. Now, having said all of this, do you think COVID has brought us somehow together in tackling climate change? Do you think people have, like early days, I saw people obviously relating to the pollution levels being low and said, okay, we can actually have a society where pollution could be low if we opt for electric vehicle or burn less coal or do whatever, at least being aware that yes. And then people were more cautious on picking up every item, saying, oh, I did not know that this is all come from overseas. Can we source it locally? Maybe we'll pay a bit more. Do you think those penny drops actually happen, or it will just short-lived and go away and we'll get used to it?
That's a good question. It's a billion-dollar question and an important one. I of course don't know the answer to that. I will say that COVID did bring the opportunity to start thinking about these things and thinking about, do we have the systems in place? Do we have the thinking and the innovations in place to tackle something like global warming? Mm-hmm. And, I think it depends on your perspective of how you think we did with COVID and how much innovation you saw around you. But I would say that that I saw signs of both. That I would say I saw signs that there was a lot of innovation, especially early on, and a lot of coming together to tackle this issue. And I think that if we can capture that and people can see the connection between a pandemic crisis and an environmental crisis, then I think there's hope. There's hope that we can kind of keep this momentum and people can kind of rise to the occasion, and they can spur each other on for innovation and for individual change, but as well as business change, as well as social change. However, as the pandemic went on, I think that I saw signs that things kind of went back to traditional ways of thinking more and more. I think people started to get used to the pandemic and started to make decisions and work together in a fashion that was kind of similar to how they had worked in before the pandemic and stuff. And I think that, so there is still a lot of need to reform the way we think about our biggest problems in society and the way we make decisions, as a society. And of course, we're talking about 100 and 200 countries around the world, and each one went about this in a little bit of a different way. And so it's hard to judge, it's definitely very hard for me or for anyone to really summarize the whole thing. Like, it just varies. I mean, a country like Singapore did a fairly remarkable job, and so did New Zealand and some of the other countries, to really try to keep this thing at bay and to come together, in society and kind of have joint goals and made tough but firm decisions about what would be acceptable and what wouldn't be acceptable. But there were other countries that that kind of didn't have that process in place and weren't able to do it as effectively, and the virus just spread like wildfire through it, and and any success they had was just pure luck, as opposed to really a well-planned, well-executed strategy. So it's tough. I will say that one of the lessons that people will take from COVID is technology, right? They'll say there was a lot of progress in terms of vaccines, and that helped save us. There was a lot of testing, and development of test kits, and that really helped a lot. And there was maybe some innovations on the IT side that helped in terms of collecting data and things like that. So people will point to some of these kind of modern, solutions, biotech and IT, and say that helped us in COVID, and that's going to help us going forward. And I think that's a good thing. I mean, those are biotech and science and IT is great. But we've got to also understand that they do have their limits, and you can't put all your eggs in one basket and expect that the science community is going to solve global warming. Just wake up one day. We're not going to have Operation Warp Speed, for the energy sector, and 9 months later have a solution. Like, it doesn't, the vaccine industry is it's a little bit easier to create a vaccine than it is completely change your whole energy infrastructure. So we do need to understand that technology fixes are going to be important, but it needs probably more thought about how it's organized. But I will go back to this idea, like in the US, we had this Operation Warp Speed. For those that don't know it, that was what President Trump put together to try to create the vaccine, and got industry and government and others to work together to try to, in this common goal of creating a vaccine. And the US wasn't the only one who did this. I mean, obviously there were vaccines created in many countries around the world. So this is not a US success story. This is a global success story. In many ways. However, there are obviously a lot of countries that didn't create vaccines, and we still don't have enough vaccines for the world. So it's not a complete success story either. It's a partial success story. But we need to kind of think about that process and how we could use something like that to tackle global warming or other environmental issues that we're facing around the world, or other threats. So, the investments, the public-private partnerships, the idea of taking some of your best people and focusing them on this issue. This was something that I think those are positive lessons that we could learn from this pandemic, that we did when it came to vaccine development. But when it comes to energy issues, I don't know that we have such a big giant plan out there, that these big innovation think tanks and innovation funds and other things that are being created. I don't know if that's happening to the same degree. And this idea of a timeline that says, within 5 years, we're going to have enough innovation to really, get off our use of fossil fuels or other things. I don't think that drive, that kind of commonality of message, is not there yet the way it was for, like, within a year, we're going to try to get a vaccine, and get over this. So that's something I think could be learned from this, hopefully.
We are not there yet, but I think it's happening. Just in 2020, Australia had about 2,600 megawatt of solar, which was quite unthinkable. People thought solar will stall because of many reasons. And globally, many companies, banks in the last 2 years have said they're not going to finance fossil fuel. Prices of solar has kept on sliding. Nothing stopped despite all the challenges. We are all super positive what will happen in the COP26 in the next couple of weeks. In Scotland, there are a lot of commitment globally. Even Australia is coming. There is a big commitment to go net zero. I think the achievement that has been made in terms of people's psyche, maybe these are not the people who feeling paralyzed, but I think there are a lot of innovative CEOs out there, young CEOs. I have interviewed, 30, 40 of them in this platform, really hyped up than they would have been. A lot of women, young CEOs as well. So I feel very positive, to be frank, out of the COVID. It's not only that the people have sort of united front against climate change, but I think a lot of individuals have taken it as a personal mission, and very positive. I think we are getting there. And of course, now investing in fossil fuel doesn't make sense because globally solar is the cheapest option. So there's a stranded asset. No one wants to lose money. So stranded asset risk is bringing people in. I mean, globally, we have now 8 million electric car running on the road. And I interviewed a friend, Greg McCarvey, just a couple of weeks back. He's saying in Australia, an electric vehicle tsunami is coming. So yeah, I think the climate change related activities is quite hyped up. People are very positive, and technology will bring the solution, whether we sit there and do nothing or not. So I'm very hopeful on that front, to be frank.
So I think bringing this back to COVID, I see there's some other lessons from the COVID pandemic up till now that we I think we can learn from. One is, I think that we need to remain very humble. There's been a lot of different ideas thrown out since the beginning of this pandemic about what it takes to stop this pandemic or to keep it under control, or what the best strategy is. And the reality is, a year and a half into this, we still don't really fully understand exactly the best way to deal with this. If we turn back the clock and went back 18 months, we asked countries what to do, they'd still be confused. There'd still be some questions about, do we close the borders? Do we close schools? Do we, do we limit travel? Do we, what do we do? Do we, how important are masks? All these questions that on the surface seem like we've learned a lot, but in reality, when you really dig deeper into this whole pandemic, you realize that there's a lot of things we don't understand about this virus, and the way we responded to it, and what really worked and what really didn't work in terms of these, crises. We didn't know at the time that, we were going to have these variants, and the variants would get more and more contagious over time. I mean, some people might have predicted that, but many people didn't predict that as well. And I would say that the analogy for this with climate change is that we also need to remain hungry and humble about what it's going to take to really curb carbon dioxide levels, right? And affect the climate. Because at the end of the day, we can create all kinds of technology and implement it. But at the end of the day, what really matters the most is that CO2 level still rising, and how quickly is it rising, and can we get it down? And so, that's the analogy of like looking at the number of deaths or the number of cases of COVID. You can say, oh, we've got great systems and we've got vaccines and we got people wearing masks, but at the end of the day, that's not what we're really measuring. What we really need to measure is actually number of cases and number of deaths, and understand what's happening there. And the same thing, I think, with climate change. We have to remember that we think that the more solar that's built, the climate will get better. But we've got to make sure that we really look at that closely, and make sure that we're, investing in all of the areas that affect climate, and not just the areas that are the most obvious to us. So we think about our cars, but the cars are only what percentage of all of global carbon emissions, right? I don't know what it is, 20% maybe, 25%. I don't know what the number is, but so that's an important thing. But we're not going to change climate change if we only produce electric vehicles and don't do anything else.
I mean, large part will be solved with climate electric vehicle, though I think 70% of all the oil that gets out goes into transportation, and transportation is mostly cars, ships, and planes. So yeah, I mean, electrification of transportation will solve a lot of those problems. But yes, obviously, that is not the only solution. I mean, energy efficiency, I mean, wasting of energy will not help. But anyway, we can go on and on. I mean, it's been a fantastic discussion. I still want to ask you one question that I asked many colleagues, saying, climate change is now well established, real. Most of the people that have come across the line. Well, at what point, do you remember a point when the penny drop happened to you, when you said you were at a conference or talking to somebody that's saying, no, sorry, this is something real, I have to do something about it? Do you remember a situation?
Yeah, I was an early converter to this, to this issue. In the 1990s, I was very interested in environmental issues. In fact, I spent some time studying air pollution. And you or your listeners may not know this, but I actually published a study looking at the 1996 Summer Olympics in Atlanta, and how the transportation changes that were implemented only for 17 days of the Olympics, but they were so dramatic over those 17 days that it actually significantly reduced the pollution levels in Atlanta and led to better health outcomes, even over that short time period. And so I did a study looking at this. It got a lot of publicity because it was a study that, even though we know that air pollution was linked to health outcome problems, it was an opportunity to show people that an intervention could make a difference, even though obviously it's a temporary intervention and it's not a sustainable intervention. You can't have the Olympics go on forever. But the things that they were done during the Olympics were things that could be done more. They made public transportation free. They stopped truck and traffic and deliveries till during the day, so they can only deliver at nighttime. They implemented a number of other strategies. They had some people, even back then in 1996, they had people work at home in terms of commuting issues. So there were a lot of things that they implemented in the city just because they were worried about pollution levels. Now I know that's not global warming, but at the time it was, that was still a time period where we were still worried in the US about air pollution. Like things have gotten a lot better since then, mainly for technology reasons. And our pollution levels are much lower now in the US. But obviously in Asia, the pollution levels are still horrendous. And so we still have this big issue facing us, and it has a tremendous impact on health. In fact, I recently saw a study that looked at this in terms of cognition, that air pollution actually may be affecting our brains in terms of day-to-day cognition. We know it affects the heart, we know it affects the immune system, we know it affects our lungs, but we didn't know it affected our brains in terms of our cognition every single day. So we're learning more and more. That's just air pollution, and that's not even thinking about all the other environmental issues. So I've always been sensitive to the idea of environmental health. And then I also, got into the idea of the built environment and how that's so important for obesity or obesity epidemic. And, how much of why we have obesity problems is because of a sedentary lifestyle and because it's not easy to get out on the streets and to do things. And so that's another, aspect of the environment. It's a little bit different than global warming, but again, it's all kind of, tied together. And all that was stuff that was being discussed in the 1990s and early 2000s. And, I think, we knew that global carbon dioxide was also increasing at that time. I would say for me, it was a little bit less of a priority than the air pollution issue and the environmental health issues, just because that's what I was working on and that was more of an immediate impact. But I had always at that time kept an eye on the carbon dioxide issues and thought like we need to start making these changes for multiple reasons. And part of it was also just dependency on oil. Some of it was, fighting our wars in the Middle East and thinking, the only reason we're here is because, we need the oil. And, those issues. So, I think there were so many factors that play into the idea that I at least was hoping that this change would start. That change would lead to lower air pollution levels. It would lead to less dependence on the Middle East. It would lead to, maybe a slightly different built environment and the way we transport ourselves and the way we look at transportation. It could have changed. It could and still can change a lot of things that have public health implications to them. So unfortunately, when I look back now at the last 25 years, since I really started getting interested in this, I have to say I'm a little bit disappointed in the overall progress. And that doesn't mean that the next 25 years won't be fantastic. It just means that to me at least, we just need to be honest about the last 25 years and try to figure out what we can do better. I mean, from my perspective as a public health official with CDC, for example, I always tried to be as honest as possible with the success of our work. If our infant mortality rates in a country or HIV programs in a country weren't doing that well, it does not help anything if you lie to yourself and to the public that, oh, we're doing a great job and everything is getting better and don't worry. I think honesty is an important part of actually solving problems. And so, from my perspective, the last 25 years have been tough. But maybe the seeds have been sown to really make a difference this next 25 years. You know, maybe there's been a lot of progress underneath the surface that was necessary for the next 10 years or next 15 years to really show a difference. That would be the optimistic way of looking at it.
Yeah, I think that's a very way of bringing this discussion to an end, that at the end of the day, it's a honest public policy. The full disclosure will get us there. Let's hope on that one. Thank you very much, Michael. Really appreciate your time. And I'm sure we'll keep in touch and see how you go. Enjoy your retirement.
Oh, thank you. Thank you. And it's been a pleasure. And I hope your listeners enjoy this, this discussion. I know we covered a lot of different topics, and some of them, we didn't really get into the science, the detailed science as much as we did the last conversation. But hopefully there was a lot of ideas generated here that people can then take and move forward on. But I would just plug one last plug, which is really to say that it's really important that we take the time and document the lessons learned from this pandemic crisis. And those lessons, meaning from a public health perspective, from a medical perspective, from a political perspective, from a social perspective, a business perspective, all of that should be done. I think it's really, really important when the world has gone through such a monumental period of time that we take the time and really reflect and discuss it. And that could be done at a local level, and it could be done at a national level, and it could be done at an international level. All of those levels are important.
Fantastic. Thank you.
Thank you for joining us this week. If you haven't done so yet, subscribe to our show. Also, leave your comments and review if you enjoyed today's episode. Follow me on LinkedIn and Twitter at @shasni for updates. That's SHASNIE. Once again, this has been Energypreneurs, connecting you to the innovative opportunities in solar power, batteries, and electric vehicles. Stay tuned.